Hello there, and welcome to today's episode of the Only Endometriosis podcast you need. Today I'm going to be talking about hormonal treatments for endometriosis. I'm going to talk a little bit about the different options when it comes to these treatments. I'm going to talk a little bit about what you may be able to expect, what you can expect, maybe what you should expect, I don't know. I'm going to talk a little bit about how you can mitigate some of the symptoms that you may be experiencing as side effects if you're currently on that journey. And I'm going to talk you through my own journey with it, as well as intersperse a few anecdotes from my clients as well. Hopefully this podcast will resonate with quite a few of you. Hopefully you'll find it interesting and supportive. And if you do want any more information, if you have any questions, then please do, in the first instance, speak to your GP or specialist. If you want a slightly more alternative view, come and chat to me or somebody like me as well. So, first off, what are hormonal treatments for endometriosis? So, as we know, there is currently no cure for endo. We're told that right from the offset, or most of us anyway, are told that right from the offset. We're told that there's different things that can be done to suppress the symptoms, and hormonal treatments are exactly that. They are not a cure for endometriosis. All they do, or all they try to do, is to suppress the symptoms that you may be experiencing from your endo. So, my own journey mirrors that of, I would say, probably the vast majority of my clients, the vast majority of people I speak to. And essentially what happens is when you go to your GP, when you're referred to a specialist, when you're struggling with your period symptoms, then the first thing they tend to do is to put you on the pill, the combined pill. There are a couple of different options when it comes to pills, and actually even when you go into the two main options, there are different brands that are slightly different within each option as well. So the first option is the combined pill. Now, the combined pill, as the name suggests, combines estrogen and progesterone. And essentially what this pill is designed to do is to completely stop your periods. So it stops ovulation, it thins the womb lining so you're not getting the same hormonal bursts that thicken and release the womb lining. And essentially what they're trying to do is to stop your periods. So they stop pain, they stop all the associated things that we get because your hormones are essentially your natural hormones are being suppressed and replaced with these synthetic ones. So in normal circumstances, the plan is that the combined pill will, essentially stop periods. Sometimes it just reduces them, but the plan is that it will stop them completely. In most cases, and again, not all cases, but in most cases, we are asked to take the pills continuously. So essentially what happens if you're taking the pill purely for contraceptive reasons, then you take 3 weeks of pills, then you have a week off. And bizarrely, so I probably should have researched this before I started this sentence, but many years ago I was told that there is no actual reason for this week off. It's just because the pill was designed by a man, and that man who designed the pill felt that women would feel inadequate if they weren't bleeding once a month. I don't know if that's true. Do your own research on that one. But anyway, irrespective, when you're on the combined pill as a treatment for endometriosis or as a symptom suppressor for endometriosis, then chances are you've been asked to take it back to back. And back to back could mean 3 to 6 months. I've worked with women who've been asked to take it longer than that as well. Again, I'm going to say there's no right and wrong. By that, I mean there's no prescriptive method of taking it. Always listen to the person who's prescribed it for you. And I'm going to say this at the end, but I'm going to say it now as well. All of these things, everybody is different. So your body will respond completely different to somebody else's body. Your endometriosis will respond completely different to somebody else's. So if you've been prescribed the pill to take it back to back for a year and somebody else has been told to only take it for 3 months, that doesn't mean it's wrong for you to take it for 12 months. There are different family histories, different ancestral histories, different slants to the endometriosis, different underlying factors that may give reason as to why you can't take it for longer or you have to take it for shorter, whatever the reason is, whatever the impact is. So that's the first thing to say that I was going to say at the end, but I'll say now anyway. Everybody's different. there is no prescribed way of taking these other than the prescription that's been given to you personally for your own needs. So the combined pill, essentially it stops periods. Quite often it can just, you can still get the period. Quite often you get to breakthrough bleeding, but essentially what it's doing is stopping ovulation. So what you can expect. So the pros, let's talk about the good things. So it's easy to take. There don't necessarily have to be massive side effects. It can help with hormonal swings. It can help with PMS. And it does, even if you do get your breakthrough bleeds, they are generally speaking lighter than your normal periods as well. Side effects, nausea. So I found that massively when I started taking the combined pill. They switched brands and the nausea did actually disappear. But that was a major impact for me for the first time, for the first brand of combined pill that I took. Mood swings, so it actually did make my PMT disappeared in that it was no longer cyclical, but I found that I was more irritable, generally speaking, when I took the combined pill. And again, that did fluctuate depending on manufacturer as well. A lot of women experience headaches. I didn't particularly get headaches, but I know from a lot of my clients that they can experience headaches or migraines on particular pills. If you're experiencing any of these symptoms, and there are more, fatigue is a big one, water retention as well, I see quite a lot of, muscle tenderness, joint tenderness, again, quite common. If you're getting any of these, then it is worth going back to your GP or your pharmacist and just explaining that you're getting them. And sometimes just a shift in brand can really, really help. Because like I say, the nausea for me was the most overwhelming symptom I got on the first brand of combined pill. But when they switched up the manufacturer, the brand name, that did actually change. So it is worth a conversation. There are different, like I say, there's different types of combined pill within the combined pill, and the same for the progesterone only, which we'll talk about in a second. So the combined pill aren't suitable for everybody. So again, like I said at the beginning, it actually injects you, but it gives you an injection, in inverted commas, of estrogen. So if there is an estrogen imbalance within your body, if your endometriosis is triggered by or made worse by an overflux, if that's actually a word, it is now, an overflux of estrogen, then actually the pill can make your symptoms worse. So not every woman has an estrogen element to their endometriosis. Not every woman has an estrogen imbalance. If that is an element of your endo or your general hormonal cycle, then the combined pill isn't going to be great for you. It can actually make your symptoms worse. So again, it can take 2 to 3 cycles to really embed. It shouldn't, but sometimes it does. It is worth speaking to your GP, to your pharmacist on a regular basis if you are experiencing either a change in symptoms or your symptoms getting worse, even during that 3-month period, 3-cycle period. Well, I suppose 3 months because you're not having natural cycles at this point. So 3-month period, if your symptoms are getting worse or you're finding that you're getting new symptoms, it is worth talking to your GP or your pharmacist, just in terms of different alternatives. Quite often, and this happened with me, even if you find a pill that does suppress your symptoms at the beginning, quite often your symptoms will start to return. And that did happen with me. It happens with a lot of my clients as well. And again, just keep talking to your GP. Even pharmacists can help as well. So the second pill, the progesterone-only pill, you may have even heard of it called the mini pill. This is, as the name clearly states, only progesterone. So it takes the estrogen out. So if you do have an estrogen element to your endo, if estrogen is imbalanced within your body, then the mini pill is going to be a better option for you. So this doesn't always stop ovulation, but obviously it does, the increase of progesterone balances out any estrogen. So the effects of the estrogen in your body are minimized. So if you do have that imbalance, it tends to synthetically bring that hormone back into that. What am I talking about? It tends to synthetically rebalance your hormones. That's what I wanted to say. It makes the womb lining thinner. So I have a theory about this, that if you have adenomyosis as well as endometriosis, then your body is going to respond better to this type of treatment because it's actually directly impacting the womb lining. endometriosis, as we know, isn't necessarily anything to do with your actual womb lining. It's womb lining type tissue. Now, that's not to say that some endometriosis isn't going to respond well to the combined pill or even to the progesterone only pill, the mini pill, but not everybody's endometriosis does or will, or long term does stroke will. So the mini pill might be a lot safer if estrogen is an issue with you. If you have certain family histories as well, then you're going to be put on the mini pill to avoid any long-term risks. And do look into the risks of taking the pill long-term as well. Speak to your doctor about that. Again, because it isn't as powerful in inverted commas as the combined pill, it can actually increase your bleed. So it can lead to irregular bleeding, irregular breakthrough bleeding, again, mood swings. It might not fully suppress the symptoms. So again, I think this is linked to the levels of estrogen in your body and the impact that your estrogen has on your body, on your cycles, on your endometriosis. So again, track your symptoms. Talk to your GP, talk to your pharmacist about any shift in symptoms or any worsening symptoms. So the next one, the contraceptive implant. So exactly the same kind of as the combined pill, but it, instead of being in tablet form, it's kind of I think I've heard them called the rod, but it's like a small rod that's implanted into your arm. Do you know, I'm saying that again, I should have double checked. All of the women I've worked with have it implanted on their arm, and all of my friends who've ever had it have only ever had it impacted into their arm. So I think I might have made an assumption that it only goes in the arm. I should really know, shouldn't I? But I'm doubting myself. Do check. Maybe you can get it other places. I don't know. I've only ever seen it in the arm. Anyway, so this is the same as the combined pill. So it usually stops ovulation, but you have the added balance of it being a long-term, low-maintenance solution, in inverted commas. So you don't have to remember to take the pill every day, and it stops your periods sometimes for a year, 2 years even, depends on the dosage within the rod. So exactly the same as the pill, you can get breakthrough bleeding, you can get irregular bleeding, you can have all of the mood swings, the hot flushes, all of that kind of stuff that you got with the pill. It's potentially got the same side effects, I guess, depending on the brand or the particular dosage as well. So do speak to your pharmacist or GP. Normally, I don't like that word, as you know, but normally you wouldn't go straight on to this. So they would find a brand stroke dosage of the pill that works for you and then mirror that in the implant. So if you are at all worried, just speak to your GP about that particular sort of journey, if you will. You can have it taken out. So if you find that the symptoms are debilitating, if you find that the symptoms are changing, if you're not happy with it, you can have it removed. But because of the nature of the way it sort of excretes the hormones, it can take it sort of up to around 3 months before it comes out of your system. Whereas the pill can be out of your system sort of by the next natural cycle. Can be. That's not definite. But as you know, as we're coming off the pill for contraceptive purposes, we're always told to take extra precautions for, right from the day or two after you stop taking the pill. That's not necessarily the case with the rod, but don't quote me on that. I would still take precautions if you're not looking to get pregnant. Panic there. So the contraceptive injection as well. So this is a shot every 12 weeks. Again, similarly, stops ovulation, stops your periods over time. And again, it's harder to reverse if side effects work because you have to wait for the injection itself to wear off. So you're kind of getting the benefits of the rod, so it's longer lasting, but the side effects as well, if you are getting any, it can be longer to reverse. So then we have the Mirena coil. Now this is the treatment, the hormonal treatment that has been the most positively received by everybody I've talked to. Now, I've never had this. I didn't go down this route as part of my own endometriosis journey, but I know many, many women who have. Essentially what it is a contraceptive coil. So it's inserted directly into the womb where it sits, and it just releases hormones locally into the uterus. So you're not getting the injections into the bloodstream, you're not getting it in your digestive system, it just releases it locally. So again, it thins womb lining. So again, I have my theory about adenomyosis. If you do have adenomyosis, then I suspect this is going to be way more beneficial than endometriosis, but there's no scientific reason for me to say that. It's just my own experience with my clients. For some women, it does stop ovulation. For other women, it doesn't. For some women, it causes pain. For some women, it alleviates pain. Whilst I say it's the most common and the most positively received hormonal treatment that I've seen in general, not necessarily just in my clients actually, but just general conversation, it also has people saying, oh no, don't do that. It really made my symptoms worse. So as I said right at the beginning, just because it made symptoms worse for friend A doesn't mean it's going to do the same for you, and the other way as well. So again, the key thing is to know your body, to track your symptoms, to understand what's happening, and to keep that communication with your GP or whoever's prescribed the coil for you, to keep that conversation going. If it does really increase your symptoms, if you notice new symptoms, then don't just assume it's part and parcel of the journey. Do speak to them, even if they abate after a couple of weeks. Track it, record it, talk about it. But in general speaking, I have had more positive feedback about the coil than anything else. Apart from the negative feedback tends to be more negative, if that makes sense. It tends to have more of a negative impact than anything else. So it's kind of a Marmite. I would say this is probably the Marmite of the hormonal treatment world. You either love it or you hate it. But look into it specifically for your symptoms. Look into it specifically how you have reacted to other things, and talk to your GP. This is why I know I bang on about it, and I'm sure you're sick of hearing me say about tracking symptoms. But this is where it comes in so importantly, because if you have 3 months, 6 months, a year, however long of tracking symptoms, you can take that full picture of what your hormonal cycle looks like to whoever's prescribing you the hormonal treatments, and they can pick the absolute best one for you from the outset. It's less trial and error if you've already been tracking your symptoms. That's not to say it's going to be right 100% of the time, but it's a better chance if you can tell the people who are there prescribing it exactly what you need. So the Mirena, like I say, Marmite. You either love it or you hate it. It can massively reduce pain. It can massively reduce heavy bleeds, but also I have worked with clients for whom their pain has massively increased on the coil. Different pain, I'm going to talk about this in a second when I talk about my own journey. Cramping seems to increase with the coil. You can, like I say, exactly the same as the other treatments. You can get breakthrough bleeds, increased spotting, emotional changes, and like I say, the pain can either increase or shift. So it is very, very personal in terms of the symptoms that you experience when you have your endo. And the last thing I'm going to mention, the GnRH injections. Oh, and actually the new endometriosis pill as well. I think I did a slight rant a few weeks ago about the new pill, but now we have a pill form, not just the injection. So normally we're used to, when we talk about these GnRH implants, we're talking about injections, but you can now, actually I'm saying you can now get them in the pill. They've introduced a pill. It's not widely available just yet, but they will be coming in pill format. So this is a stronger version, essentially, of the pill. It has strong impact, I suppose. It essentially what it does is temporarily induce the menopause. So it's a hormonally induced, a chemically induced menopause. It completely shuts down your menstrual cycle. It lowers estrogen, theoretically, to shrink the endometriosis. Although, like I say, I know firsthand, not every woman's endometriosis is impacted by estrogen. So for some women, this will have absolutely no impact at all. Some women, it's used as a last-ditch resort before surgery, trying to maintain some sort of suppression of symptoms, management of symptoms before surgery. I didn't realise it at the time, but that was my experience of it. I think, well, that's not strictly true, because had it worked long term, then they would have just, I was offered sort of waiting for it to get worse and then trying it again. I don't know if they still do that, because I don't think that's particularly healthy. But I know most of my clients now who've been on these injections, it's used as a sort of a temporary suppressant, trying to make symptoms better before surgery. Prostrap and Zoladex are the two main brand names here, but they do pretty much the same thing. So this is longer lasting. It's fairly drastic. The pros, I guess, if listed on the back of the box, are that it's big symptom relief, but the side effects are or can be quite considerable, and like I say, it won't work for everybody. To be completely transparent, I was on the Zoladex injection and it did work for me. My endometriosis symptoms, I would say, disappeared. Oh, no, they didn't. I'm going to come to that in a second. The pain that I was experiencing disappeared, but actually I just got different pain. So the pain that I was experiencing through my natural cycle, through the combined pill, that disappeared. But instead I was left with a tenderness and almost like a bruised feeling pretty much all of the time, which isn't as debilitating in some ways, but can be more debilitating in other ways. I got massive hot flushes. That was the key thing for me from this treatment. Not just night sweats, but during the day. It was incredibly difficult to manage. I do have a hot flush kit, so if you are currently experiencing this, then I'll try and remember to put the link in the show notes for this. But there's a hot flush relief kit as well, because I found them the worst part of this treatment cycle. Emotional side effects. So I just became completely disconnected, completely numb, almost emotionally numb. It was almost like, so I've only been on antidepressants once or twice, I think, when I was much, much younger. And for me, the feeling was very, very similar. I didn't have the emotional ups and downs, but I didn't really have any emotional ups and downs. In fact, I had more emotional downs than anything, but it was pretty kind of stagnant, pretty kind of flatlining. Completely disconnected from my body, just completely, numb, I suppose, is the best way of thinking about it. Again, one of the side effects that's noted on the back of the box on the small print is bone thinning. So quite often, if you have a family history, they will actually suggest that you have hormone replacement therapy, so HRT, add back HRT, just to alleviate some of the more long-term symptoms, which again, for some women, is actually going to exacerbate symptoms. It's the same when I say about post-surgical menopause, so post-hysterectomy. A lot of women are offered add back HRT to mitigate the symptoms of the induced menopause, but actually, because your endometriosis is still in your body a lot of the time, because obviously getting rid of the womb doesn't necessarily get rid of endo, your endo can flare because the HRT is putting back the stuff that the operation is designed to get rid of, if that makes sense. But anyway, I'm not here to talk about that. I'm here to talk about hormonal therapy. So they are the different options when it comes to hormonal therapy. And I'm going to talk you through, I've kind of talked you through a little bit about my journey as well. But I just want to talk you through. So essentially what happened was I got put straight on the combined pill. When various pills didn't work, we chopped and changed dosages, we chopped and changed brands, and some of them worked, some of them didn't work. Some of my symptoms disappeared, I got new symptoms, some of them changed, but over the years that I was on the pill, nothing really gave me that long-term relief. So I then went on to the Zoladex injection. And again, that gave me fabulous relief. It gave me different symptoms, which weren't so fabulous. But the main symptoms I was experiencing from my endo did kind of disappear or change if they didn't disappear. I was on that for 6 months and the symptoms abated for another 6 months after that. So I kind of got about a year of relief, but then the symptoms started coming back. And when they came back, they were horrendous. They were even worse than they were to begin with. And sadly, that's quite a common story. I should say that for some women, symptoms don't return at all. So for some women, just being on the pill absolutely helps and they don't need to ever try anything else. For some women, changing to the progesterone only, to the mini pill, helps. They never need to try anything else. And they're both fabulous. Sometimes the injection works. Sometimes I was going to say the brand name again, but I don't want to endorse brand names. Sometimes the implant works as well, the hormonal implant. It doesn't necessarily follow that your endometriosis symptoms are going to return. However, in the majority of cases, they do return. Doesn't necessarily mean as well that they're going to return worse. Sometimes they are way more manageable as well. It is unfortunately a bit of a gamble, which is why I talk a lot about symptom management, about reducing the symptoms that you can naturally, because then even if you learn how to do this and then go on to do these hormonal treatments, that's absolutely fine. At least you've got a toolkit of things you can use if your symptoms do return. So things that I wish I'd known when I was starting or throughout this hormonal therapy journey. Your body changes its mind, your body changes. You might feel absolutely fantastic on a treatment at the beginning or for a few months, and then your symptoms might come back, or you might just feel not great. You might feel different symptoms, so anxiety, the nausea that I experienced, hot flushes, cramping, spotting, all of those kind of things. And it's okay to go back and say, do you know what, this was working, but actually it's not working anymore. Have you got anything else? Can we tweak it a little bit? Is there anything else you can give me? Or look at doing the alternative side of things, looking at doing the stuff that I talk about alongside to mitigate some of the symptoms that you're experiencing. It doesn't make you weak. It doesn't make you pushy or difficult or ungrateful. If your body's changing, if you're noticing things you're not happy with, that's all about empowerment. It's okay for your body to react differently in month 6 than it did in month 1, positively and negatively. That just makes you human. We are very complex beings. So if something works for you and then it stops working, don't be afraid to go back and talk to whoever it is that's prescribing you this medicine, because essentially it is medicine, and we would do it with anything else. If we had, if we had tonsillitis and the antibiotics that we were being given weren't working, we wouldn't think twice about going back to the doctor and say, look, these are rubbish. I've been taking them for 2 weeks. I'm still really struggling. We wouldn't think twice. This is exactly the same. It just makes you human. Hormonal therapy can be a solution, and I'm not in any way trying to diss the idea of hormonal therapy. For some women, it absolutely works. If you are taking hormonal therapy long term, just be mindful that when you stop taking it, just track your symptoms, just be mindful of the changes that your body goes through, because you may find your symptoms return. You may find that you get different symptoms. They can just be a side effect of stopping the medicine, exactly the same as any other medicine. When you come off it, you do tend to maybe feel a little bit weird for a period of time. This is exactly the same. But again, track it, keep that dialogue open. It can be something that you use before surgery. Again, that's absolutely fine. If you know you're having surgery and you're willing to put up with the side effects that you may experience before surgery, that's absolutely fine. Again, there's things that you can try alongside it. It can be something just as a stopgap. Do you know what? I've just had enough. Just give me these injections for 6 months. Just give me some breathing space. I know a couple of women in the last, 3 or 4 years that have done that and then come to see me. And in the time that they have been on the injection, we've worked together to look at strategies just in case the symptoms do come back. And that's absolutely fine too. There's different ways, different journeys. There's no right or wrong way for this. Also, just to reiterate what I said at the beginning, there's no one treatment that's going to work for you. So just because one treatment worked for your friend, just because this treatment worked for your sister, it doesn't mean it's going to work for you. The exact opposite is true too. Just because I've said that this didn't work for me, I will have had clients that it absolutely did work for. Some women will never have been clients because the low-level treatment absolutely did work. So don't discount anything, don't dismiss anything. Don't put all your eggs in one basket thinking that one thing's going to fix you either. Fix you, I can't believe I said that, but you know what I mean. So my journey with hormonal therapies is actually what led me to do it completely differently, because I didn't get long-term relief. I was sick and tired of feeling like I was a guinea pig. I was sick and tired of feeling like nobody was really listening to me. I wasn't getting the answers I wanted. And when they said, okay, none of this has worked, let's try surgery, I wasn't full of confidence that surgery was going to work anyway. Now, I am well aware that I speak from a place of privilege. I already had a little bit of an insight into the world of alternative medicine, natural healing. I didn't necessarily have the fear and confusion, and my symptoms, although they were coming back and although they were a lot worse than they were to begin with, I still wasn't at that point where I was just like, do you know what, just take it all out, I'm sick of it. I never got to that point. So I am speaking from a point of absolute privilege. But just to let you know that there are different options out there, whether you want to do them alongside your hormonal treatments, whether you want to do them to mitigate the symptoms of stopping your hormonal treatments, or whether you want to kind of prolong the need for the hormonal treatments. Whatever your journey entails, that is exactly fine. Completely fine. And I just want to say that if you're listening to this podcast and you're feeling unsure about the current treatment, please do talk to your doctor, because there are different alternatives out there. If you've come off hormonal therapy and you feel like you're starting from scratch, you're not. Your body, I know I just said fixing about 2 seconds ago, but your body doesn't need fixing. Your body isn't broken. It's just about finding what works for you. And I don't have the answers in the same way that your doctor, your surgeon, your specialist doesn't have the answers. I don't have the answers either, but I do have some options that you could try if you feel as if you're at a loss as to try anything else. You do deserve that support that honours your whole body. We don't just want a sort of a sticking plaster solution, but there are other options you can add into your journey. So if you do want to talk to me about your endometriosis, I'm always here. Drop me a line, drop me a message. You can book a call with me. You can book an online consultation with me. If you are in Lancashire, then you can come and book into my clinic. I have reopened my clinic. I now see women again every Tuesday afternoon currently, but do check my website because that may change. Who knows? But yeah, if you do want my help, then please do find me. And I will put a link to the Hot Flushes toolkit in the show notes as well. If there's any episode you want to see, then please do let me know. I hope you've enjoyed this one. I hope it's helped. Be kind to yourself. You are doing better than you think. You are fabulous, and well done for taking the step to find out different options available to you. I wish you every health and happiness, and until next time.